And the last year, of course, has been difficult for everyone, but the toll the pandemic has taken on healthcare workers is likely immeasurable.
Our Brendan King has been keeping in touch with a local ER doctor who he first interviewed last year. Brendan spoke with him today about how things have changed in the last 12 months. Brendan?
Yeah, do you remember 1 year ago today, Governor Ralph Northam had just restricted social gatherings to no more than 100 people. Virginia was not even in lockdown yet, but it was the medical professionals early on that were seeing more and more of their sick patients walking into the emergency room.
You wake up in the middle of the night in a sweat, thinking, I've got a fever, I'm sick.
ER physician Dr. Carlton Stadler reflects on 1 year fighting the coronavirus.
But it certainly reaffirmed that I'm in the right place because I think we've seen the worst that it can be. So it's not if, but when. When is now. When is here.
March 16, 2020, we first spoke about a new emerging disease in America called COVID-19.
I think at the time we felt like this was a distant disease. You know, we knew it was out there, but it didn't really hit home.
Dr. Stadler serves as a member of the Virginia College of Emergency Physicians.
Very quickly, we went from being very concerned about the number of ventilators we had to the number of gloves and PPE, evolved into a real fear of I could bring this home to my family.
On the day of our first conversation, doctors confirmed 45 positive cases in Virginia and 1 death linked to the coronavirus.
Like I said, emergency medicine, we don't bring home any of the heart disease or diabetes or anything. This was something that all of us stood a chance to bring home.
He says the virus forced him to have those tough end-of-life conversations with his family. What would happen if he got sick? Is his life insurance up to date?
The most dangerous thing I did all day long was walking in my front door of my house.
Now, Dr. Stadler fears another increase in COVID cases as some younger generations party on vacation and spring break.
I think that certainly variants have the possibility of causing that next surge, especially in our most infectious population, which are younger people. Those aren't the ones that are getting vaccinated yet.
And the doctor did want to point out one positive during this pandemic. He says flu rates have dropped dramatically. He tells me of all the hundreds of people, the hundreds of patients he's treated over the last 6 months or so, he's only diagnosed 2 patients with the flu, and he credits mask wearing, social distancing, and hand washing with the decrease in flu cases. Working for you in Richmond, I'm Brendan King, CBS 6 News.